Next, after that's done, the laboratory is now going to merge the data sets. They're going to take the CAT scan data that you took from the cone beam CT, and they're going to take the intraoral surface data, and they're going to put them together. And from that step, they can now do surgical planning. Because the surgical planning can only be done once we know, right, where the teeth are going to go. So I'm going to give you an example, okay? Not TEDRA, different patient. This is a patient that was going to have the 4 mandibular anterior teeth extracted, and 2 implants were going to be placed. Now, I have a lot of questions, okay? When those 4 teeth are extracted, right, you see the crowding of those teeth? How many teeth are going back? Is it 3 teeth, or is it 4 teeth? Okay, because the patient's not going to have orthodontics to expand the arch or do anything like that. So that's question number 1. Question number 2, when the teeth are extracted, can the implants be placed immediately? Now, what's going to be important to know relative to that is where are the implants going to go? Where are the teeth going to go? If the implant positions and the tooth position is going to be similar to where they are now, then perhaps the implants can be placed at the same time, right, at the same time of the extraction of the teeth. Well, that's not going to happen if there are 3 teeth to replace now those 4 teeth, right? So then you're going to have to extract the teeth, allow the area to heal, and then come back. Otherwise, you're going to be forced into an area of one of the extraction sockets. If, however, there are going to be 4 teeth placed, and the location, the overall position of the roots and where the teeth emanate from the soft tissue is going to be similar to where the positions are now, then you can extract the teeth, right, and immediately place the implant. And that can also help determine whether you can immediately provisionalize the case, or not, or how you're going to go ahead and do that. Does the patient have to wear a transitional removable partial denture? Can you immediately provisionalize the case? All of those things are going to help make the decisions. So what do we do first? We do a diagnostic wax up, right, a virtual wax up, and I say, wow, I could shrink the mesial to distal dimension of the teeth down, and it's going to look nice with 4 teeth, right? So I'm already starting to go ahead and answer some of my questions. Based upon that, the implant positions can be selected. For me, I don't like to place them as a bridge in 23 and 26. I like to restore this every other tooth. There's a better chance of going ahead and developing a nice soft tissue architecture with papilla if you do it in every other tooth style as opposed to doing it as a bridge where, there's a single implant under each lateral incisor tooth. Okay, so back to TEDRA, okay? So here's TEDRA. The intraoral surface scan has been merged with the CT scan, and a basic plan has been made. My involvement to this point has been sending the CT data along with the intraoral surface data, my TRIOS data, to the laboratory and saying, I want to put an implant into area number 5. All this has now happened behind the scenes. Ro is now, has technicians that are expert in planning, creating the plan. And so when they create the plan, the software allows us to do a lot of different things. It integrates, right, the surface scan. It integrates the virtual wax up with the area of bone, right? So that you can identify in the planning exactly where you want to go ahead and place the implant relative to the position. It's not just putting it in the middle of the space. It's putting it so that you have a proper emergence profile, right, and a restorable position for that implant, right, without violating any anatomic structures. And so you can look at all the different images, and from all the different images, go ahead and identify that you're not going to run into any teeth and properly position your implant. At this point, right, Ro's done all the planning, except, Ro, this isn't Ro's patient, right? This is my patient, and I'm responsible, and I'm liable for this go-ahead patient. So I have to go ahead now and decide if I like what Ro did. So what happens is there's an online meeting that's set up. So there's Jason, right? Jason is who I worked with on this case. What? Hold on a minute.